these special tests are going to be assessing the integrity of the ligaments around your neck. So for these special tests, I will have to place my hands around probably your upper back and shoulder area, definitely around the back of the neck area, as well as possibly the base of the head, possibly to the sides of the neck. Purpose of these, I mentioned, is to assess the integrity of the ligaments of your neck, but there is a chance that we might possibly provoke some discomfort while we are performing these special tests. So if you feel uncomfortable at any time or need me to stop or change, just let me know and we can modify accordingly. Do you have any questions? Oh, but hopefully we'll be able to gain information about your condition and to develop a treatment plan for you. Do you have any questions about what we're gonna do? Do I have your permission to continue? Thank you so much. So I'm gonna get you to lay on the table on your back, head at this end. Thank you. All right, so ideally I put a pillow on your knee. Now for this, before we get into the actual transverse ligament stress test, you will remember our sagittal shear test, right? Anterior shear, sagittal stress test, I combine the words. So for this one, what are we landmarking on for the anterior shear sagittal stress test?
Anterior shear, under the Spanish part of C7 to
the ala.
The articular pillar specifically, but you could landmark on the posterior aspect of the TVPs. Which segments are we testing with the sagittal stress test? For anterior shear.
C7.
C2 to C7.
C3.
According to McGee, it says C1 to C7, but when we're doing this test on C1, it's the transverse ligament stress test instead. Okay, so biggest difference between the sagittal stress test and the transverse ligament stress test is the transverse ligament is only securing the C1 to C2. It does not exist anywhere else in the C spine. Therefore, to perform the transverse ligament stress test, you must landmark on C1. To perform that exact same motion on any other segment, you are performing the anterior shear or sagittal stress test. So both tests are done exactly the same way. The only difference is which segment you're landmarking on. Does that make sense? Okay. So for sagittal shear, I start at the bottom, C7, just because I like starting at the bottom, and then landmark, and I bring everything forward, hope for a firm end feel. And then I assess C6, C5, C4, etc., etc., etc. Right? Straightforward. Transverse ligament stress test, you are going to be landmarking on the posterior tubercle of C1. Okay? The reason why it's C1 is because with Shakira laying on the table right now, her C1 is here, the dens of C2 is on the anterior aspect of that vertebrae. So the biggest mistake I see with this special test is people landmark on C2 and try and push C2 forward, but when they do that, the dens is literally hooking into the back of C1 and bringing it forward with it, right? But the transverse ligament, you guys can see, the transverse ligament is what's securing that dens in place. So when we push the C1 forward, technically if the transverse ligament was compromised, then the C1 would drift away from that dens. But if the transverse ligament is doing its job, then when you push forward, there should be a firm stop as the transverse ligament is actually securing that C1 on the dens. Does that make sense? Great. So, nice and easy transverse ligament stress test. We're gonna go ahead and landmark on the posterior tubercle of C1. So all you need to do is landmark, you'll find the SP of C2, your vertebrae is rotated.
I know. We know this.
Okay, yeah, we will fix that at another class. You will find the SP of C2, and you will find the occiput, right? You will landmark directly between that S2 and that occiput, and you will passively, there you go, passively bring your patient into slight capital flexion, and you will be able to feel that posterior tubercle. Okay, once you've landmarked on that posterior tubercle, you will go ahead and drift anteriorly, lifting that C1 and preferably their head as well too, all in one. And you should feel it give you a firm stop, which yours is, which is good. Your transverse ligament is nice and strong. Yay. So again, landmark posterior tubercle of C1, and you're just going to drift forward, and you can see that's a nice firm stop. Her head wants to stop. So yay, that was a negative. A positive would be if your patient complains of dizziness, numbness, possible lump in the throat, and for you as a practitioner, you feel a soft end feel, or it just keeps going. away until it stops if you find that it's going further than it's supposed to. Just make note that it's not supposed to go that far. Okay? But don't find the end range. Okay? Okay. So the indication for performing this special test is what? Patient reports a history of a motor vehicle accident. Okay. Nice and easy. Okay. Tissues being stressed.
Ligament, transverse ligament.
Transverse ligament. Wonderful. And a positive sign is soft end feel, and it's a positive for a loss of integrity of the transverse ligament of the C-spine. Make sense? Great. Where'd I put my remote?
You put it.
I put it down somewhere.
You put it on the table.
Did I? Oh, well, that wasn't very good. Thank you, Edna. All right, the alar ligament stress test. Now, according to McGee has this test done with the patient seated on the table while doing this special test. The reason why I highly encourage you to do this special test supine on the table instead is because when you are upright, seated, or standing, the muscles of your neck are going to be engaged to keep you upright, which means any mobilization or any sort of joint play you are trying to perform on the neck is going to be limited simply by the fact that the neck muscles are contributing. All right? So technically, you can assess to see if the alar ligament will stop you, but you will have better application of this special test with your patient in supine because then their neck muscles cannot fight you. Does that make sense? Or I should say is less likely to fight you. Of course, there will always be a patient who will be able to fight you, right? So for the alar ligament stress test, what you're gonna do is you're going to pincer grasp the C2SP. So the idea is you are going to be moving their head and you want that SP of their C2 to not move, okay? So I'm going to landmark on, oh, Shakira, so we're gonna move on to our second special test, which is pretty much exactly the same consent of all the other ones. The purpose, the only difference being is we're testing a different ligament of your neck, still same reasons and all that good stuff. Do I have your consent to continue with that terrible consent? Thank you so much. All right, so we are going to use our non-assessment hand to grasp onto that C2. You can do the I got your nose style pincer grasp. You can do like this style pincer grasp. Experiment to see what feels better for you. I like the I got your nose style. You guys know what I mean. So you're gonna grasp onto that C2SP and give your patient a second to kind of relax into that. You're gonna pinch it so it doesn't go anywhere, and you are going to check this ligament in two types of motion. You've got rotationally, you're gonna pin it and you're gonna try and rotate, and there should be minimal rotation. You can see I'm not rotating her head very much. That's because that ligament is actually doing its job. It's holding her head from going any further. The second motion that it's checking in is lateral flexion. So again, you're gonna grasp that C2 and you're gonna try and laterally flex. And laterally flex. Again, you can see I have minimal movement happening here, right? So that is checking the oblique ligament that we call the alar ligament. Okay, it attaches obliquely from the occiput to C2. All right, so very, very easy. So transverse ligament stress test, literally landmark on the posterior tubercle of C1, just drift forward. For the alar ligament stress test, you're going to landmark on the SP of C2, and you're gonna check in rotation and lateral flexion. Okay, so feel free to go ahead and try that in seated and versus supine and see how it feels for you as a practitioner versus you as a patient. If you find that you feel like you do a better job with them in seated and you're getting the information you need, then by all means, according to McGee, that's how you're supposed to do it. But as practical application, personally, I find having them in supine is easier for me. Okay, so does anybody have any questions about those two special tests? Okay, and then lastly, we might as well do some review for the vertebral artery test, just for the sake of it. What are the three directions we are going to bring our patient into? Extension, lateral flexion, and rotation, how far?
50.
Minimum 50. Minimum 50, why? What structure are we testing with this special test? The contralateral vertebral artery. The contralateral vertebral artery. Okay, so So if I'm bringing her head towards the right and the right, we are assessing the left, which means you must go past 50 degrees of rotation. Make sense?
Yes.
Okay. Do I have to actually show you guys the vertebral artery stress test, vertebral artery test again? Or do you think you got it? I hope you got it. Okay, so you're gonna partner up hopefully with somebody you haven't worked with today. You're gonna go through your consent and we're gonna practice the 2 new special tests.